የቀን ወደ ተገኝተ የዛሬው ልዩ ቀን ቢደገም የዛሬው ልዩ ቀን ቢደገም ልዩ 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 ቀን ነው ልዩ 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 ደስ የሚል ቀን ነው ልዩ ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ደስ የሚል አንድ ቀን ጊዜ ልዩ ቀን ደስ የሚል አንድ ቀን ጊዜ ልዩ ቀን የዛሬው ልዩ የቀን ወደ ተገኝተ የዛሬው ልዩ ቀን ቢደገም የዛሬው ልዩ ቀን ቢደገም ልዩ 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 ቀን ነው ልዩ 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 ደስ የሚል ቀን ነው ልዩ ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ደስ የሚል አንድ ቀን ጊዜ ልዩ ቀን ደስ የሚል አንድ ቀን ጊዜ ልዩ ቀን የዛሬው ልዩ የቀን ወደ ተገኝተ የዛሬው ልዩ ቀን ቢደገም የዛሬው ልዩ ቀን ቢደገም ልዩ 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 ቀን ነው ልዩ 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 ደስ የሚል ቀን ነው ልዩ ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ዛሬ ልዩ ለት ደስ የሚል ሆኖ ሳገኘው ሁሌ ይሄ ቀን በሆነ ብዬ ተመኘው ደስ
orientation and qualification. He started his career as a graduate assistant at Jimma University, following the completion of his first degree in sociology from Gizaw University. Subsequently, he did anthropology from the same university, and epidemiology from the Swiss Tropical and Public Health, the University of Basel in Switzerland. Dr. Mirgisa has rich experiences and competencies in teaching, research, and community services. He advised and promoted more than 40 master's and PhD students in the field of public health and anthropology. The students mentored under Dr. Mirgisa are now serving the government at leadership and key program maternal and reproductive health, HIV/AIDS, cervical, with several awards at national level as well as at program level for his merit, and is involved in several policies of research as PI and as an external examiner for this country. Dr. Salim Tamir has a PhD in human nutrition, and he is currently serving as an associate professor in the Department of Nutrition and Dietetics. He is also the department head of the head of the department for the Nutrition and Dietetics department. He has more than 17 trainings that are related to his profession. He has led and deployed more than 11 consultancy services. He has published 53 articles in peer-reviewed journals.
Chairing the session, and I will introduce the supervisors of Abraham. As you can see, we have two supervisors, and I don't think both of them are here with us. Professor Morankar is a professor of medical anthropology here in Jimma University, and director of the Evidence-Based Healthcare Center for JBI, Center of Excellence, and he has published more than 140 research articles. And we welcome Professor Morankar. And the second promoter is Dr. Pradeep Sopori from the US. He holds, introducing the candidate. So the first promoter is not here, and Dr. Fira will introduce.
The name of the candidate is Abraham Tamirat Gizaw. He was born in Walaita Zone, Araka town in July 07, 1986. He obtained his first degree in medical laboratory technology from Jimma University in 2008, and the master's degree in MPH in health education and health promotion from the same university in 2013. He has published more than 50 research articles in reputable journals. Please welcome, join me in welcoming the candidate. We have around 45 minutes. Sorry, the chairman will invite you. Yeah, I'm playing out of my
minutes for the presentation.
So the title of presentation is Effectiveness of Positive Deviant Approach to Improve Mother's Nutritional Knowledge and Self-Efficacy in Child Feeding. The young child feeding practice plays a crucial role in determining the nutritional status and overall health of children in the first 2 years of life. So World Health Organization recommends, I think it's better to stay here. So World Health Organization recommends exclusive breastfeeding for 6 months of life and continuing introduction of complementary feeding and continuing breastfeeding to the year of 2 and beyond. However, global data suggests that there are many children under 2 years of age that are receiving suboptimal feeding, and this has a long-term consequence on the suboptimal feeding practice. Therefore, Ethiopia is an approach to avert what's happening. Obviously, saying this, why this PhD is important? Because there are significant gap of infant and young child feeding and growth in Ethiopia. So this reason behind the gaps are multifaceted in its nature. Therefore, there are so many factors that contribute to these issues. Lack of knowledge, attitude, self-efficacy toward optimal feeding practice. This can lead to suboptimal feeding practice, and there are also cultural beliefs that potentially contribute to suboptimal feeding. This also contributes to the high prevalence of stunting underweight and wasting. Therefore, understanding such factors and bridging this gap is very important and possibly very important to improve nutritional framework. After reviewing different literature, we try to develop this conceptual framework together with my supervisor. The first is this approach is positive intervention. So it has different intervention modalities, and such intervention modality will be employed. And there are also mediating factors, social demographics or barriers, and attributes of child plus household food security status are potentially influence the intervention outcome to the mother's self-efficacy. The social cultural factors that has been identified at baseline study of qualitative study. Therefore, the objective of the study is to evaluate effectiveness of positive deviant approach in improving nutritional knowledge, attitude, self-efficacy, and child's nutritional status in southwestern Ethiopia in 2022. So, specific objective is to assess the level of breastfeeding knowledge, attitude, and self-efficacy, and is predicted as baseline. And the second is to assess the determinants of knowledge, attitude, self-efficacy toward complementary feeding. And the third one is to explore maybe the area, declining nutritional tuning, and also for breastfeeding attitude score. This is in line with the study in Ethiopia using the same intervention positive approach, and it is also in line with Ethiopia, particularly these studies were conducted in Jimma as well. And regarding breastfeeding self-efficacy, it is also bias and factors and effectiveness of the intervention. So we can recommend underweight in rural area. Having said this, finally, recommendation. So recommendation to policymakers. There should be a continuous policy dialogue or discourse between researcher and policymakers, using evidence from empirical data changed into policy language or policy briefs to improve appropriate infant and child feeding practice, especially in rural Ethiopia. Therefore, the policymaker should customize the policy and procedures that could consider the local culture for promoting appropriate infant and child feeding practices rather than directly adopting the global conceptual frameworks. Recommendation to health sectors: work to identify local problems, develop tailored and implement context-specific. The importance of community healthcare provider, recommendation to the healthcare provider and public health partners should incorporate positive deviant approach in infant and young child feeding programs, and along with other comprehensive determinants of the malnutrition. So, future research perspective, more research on the intervention feasibility, sustainability, and adaptability is required, since this is short intervention. The other is future recommendation. Researchers should consider evaluating the intervention. Promotion research should consider the. Therefore, these are the published work of the PhD, and my acknowledgement goes to the Almighty God for letting me to do this research, and my promoters, Professor Morankar Sudhakar from our department, and Dr. Pradeep Sopoli from Wayne State University, and my family's mother, child, wife, and those who supported me through this process, and positive deviant mothers, participants, data collectors, facilitators, health, behavior, and society department staff for their kind support of just making me to stand here, and friends, Majorada, volunteer officers, Jimma University Institute of Health for financial support, Professor Tafara, and other colleagues. So this dissertation is dedicated for 3 children who have since left this world area due to disease problems. So these are some of the references that I have used. These are field photos, and I joined the community by drinking Borde, and finally, thank you for your attention. So now we have PhD defense. Well done, Abraham. Thank you for this very good presentation that you made. Just to start with, by way of disclaimer, few points. The presentation
the very rich document, the publications, which are all excellent in their own right. I always think broader in a systems way, linkages, and the questions that I'm going to really challenge you with actually revolves around this. So that's, I think, very important point to me. I believe those of us in the university and yourself as a university staff, as future educator, current educator, researcher, scientist, you are going to be influencer. So as an influencer in the future, I just want to test you if you are up to that speed on the basis of what you have done, which is linked to my first disclaimer. This is my second disclaimer. I hope the questions and answers, the challenges, would actually give everyone, yourself included, an insight on on the questions entirely throughout. And I failed to organize myself into specific questions. Questions are very light, very easy. Feel free to say, wow, these are just easy ones. Why does he ask me this kind of questions? But let me ask you one very simple question. In reading about the entire piece, I was looking, meaning why didn't you do it in second? Why didn't you do it in class? Not too much. Very simple.
I think this issue, initiated me for my school age. While I'm looking to the people that are selling better their grains, and when you see visit people, their child, they are very, very much undernourished. So my question was, there is, the area is great, and there are different resources why people are unable to feed their children, properly, and that's why it's nearly a problem by the research in that area. That's why, from my past experience.
So it's always good to indicate those. This is very important. Somebody would say, what is fun about this? But showing this kind of points in the thesis will actually make it even. Yeah, you have this dissertation. When we talk about dissertation, it's not thesis, This is a sort of groundbreaking, thoughtful kind of initiative. And I was asking myself, what was it that Abraham is driving at? What is the foundational premises, the foundational perspective that led you to do this research? I read through the material and I'll come into details from your presentation as well. I didn't get a concrete kind of perspective. What is your perspective? What is your thought, your philosophical foundation of this study?
For this study, as I have said earlier, even though there was a research question in my mind that why? And I think then through this search for truth, search for the social world, what we call it, maybe ontology, and then there is truth or reality in somewhere, and how I'm going to reach this reality was my concern. I think epistemology and the issue of looking into which approach, is that for qualitative or quantitative. Actually, initially I was thinking to carry out pure qualitative as a whole, but due to different reasons, I tried to triangulate it as a baseline, both quantitative and qualitative. And I tried to reach to that point because of my experience and my philosophy of knowing what is really happening to that specific and how I'm going to reach to the realities that was developed as a childhood.
Excellent. Thank you so much. So, I like that it links to your first response to your observation as a child. So then
I was planning to have concurrent type of design that I'm thinking those findings from the qualitative will reshape the intervention manual and the intervention modality, and it is later on incorporated to the intervention. For instance, gender roles, the cultural understanding of marriage. So the mothers believe that this is how our ancestors have gone through, and we are not able to change that. But those positive deviant mothers, how they think, cultural understanding of their marriage. So others believe that they are just solely material to their husband, but positive deviant mother think that, oh, I am his wife, so that he can also support me, he can support him. These are very important from the qualitative studies that I found, and later on I have integrated in the interventions. To support, it's not to support, but concurrently to have some modification on the intervention modality.
Yeah, so how does that design actually stands with my philosophical, ontological foundation is very important, which I sort of felt is missing in this. Am I right?
It is better to maximize, I think as a recommendation, I've also said this for future researchers, that there should be, husband involvement, even in the quantity. So I think playing with the number and playing with the reasons is a little bit balanced. And in our case, we are just focused on cluster analysis, its effects, size, and the like. But it has both its own contributions. While dealing with the qualitative and the quantitative part, the intervention has effect, but the effect is highly reflected in some variables, which has a practical implication for future study. But the most likely the quantitative part and the quantitative part has to be balanced at this part.
You agree with that, and then we'll come back to that same argument later, right?
Fine.
Okay.
And objective is it is a kind of roadmap what the research is going to be going to achieve.
For research questions, how do you comment on it?
So,
educators, influencers. I mean, that goes back to my thoughts. As I said, I'm personally a system thinker, more linear than system. Do you agree with that? The whole complexities of infant and youth child feeding practices. So you said it in the document itself, the foundation and the basis, and then you are showing that it sort of influences. But what is it that it is that your presentation has also clearly shown? Animals are very important. So I have to also be educated and I have to really understand the realities behind it. Looking at
as they know the socio-economic status of the community, rather than adapting the global framework, conceptual framework directly, it is better to look into the regional setting, look into the zonal setting, look into the specific target group. Therefore, I personally think that some of the policies are blind to those vulnerable segments of the population, honestly speaking. They are very operational in service. Little is known about it. Yes, we are in another scenario. So, and even though these nutritional programs are there, still the change is very low, very low. And the malnutrition status is high. Therefore, that's why I'm interested to address such a peripheral part of Ethiopia.
And there are also students who are graduated by doing all this issue. The other thing, or my point is, when I see the nutritional status, which you reported in your document, is less than the national one. The nutritional problem, especially the nutritional status problem, is malnutrition or stunting, wasting, underweight it's smaller than, or it's not, the figure is, or the prevalence is not even equal to the national one or the regional one. It's very small when we compare with the national, regional one. Huh? Well, the problem is very low there. Well, the prevalence or the figure of this problem is low there. What initiated you to conduct this study? Because when I compare it, the one which you reported in the main document is the total prevalence of, when we compare with the national one, with the regional one. So what initiated you to conduct this there in Mali? If I were you, first I would select areas where prevalence of malnutrition is very high. Like if you take in Ethiopia, there are wilderness where the prevalence of malnutrition is very high, like Manna. Yeah? So if you have any response.
My concern from my experience that on the nutritional practice or habit of the target population and the community in that district triggered me to do such a research. But if the prevalence led me to do this research, maybe I plan to have with high prevalence, especially in some northern part of Ethiopia and the like. But I don't know, from my experience on the area, it triggered me to do so. Actually, standing wasting and underweight is a little bit lower than the national data. But I want to do even with this low, as it's comparative. Actually,
What would be your hypothesis?
Pardon?
Hypothesis. What would be your hypothesis?
Positive deviant approach can significantly contribute to nutritional status of the child in intervention.
Yeah.
How are we going to improve the practice? Because the practice is coming prior to other predisposing factors like knowledge and people like. Therefore, with this, we are just reshuffling it to improve nutritional status. So this is the baseline.
So you are saying that I have a lot of data to be analyzed later or to publish later. If that is the case, why did you include that objective in your dissertation? That's the problem.
Different language, different culture. Even in one book, there are different populations.
Asset-based approach. It is a strength-based approach. People in the community are
Lisa will be finalizing.
Yeah, thank you. Thank you very much, thank you. Three fundamental, basic, results that you are happy about from your study. Three. What are the three major?
first reaching unreached community.
No. Finding. I'm talking.
Outcome.
No. State it clearly.
I think from the way that rural mothers do, the way regarding infant and young child feeding practice, and the coping response, the second one, whether they are healthy or unhealthy. So they have their own wisdom of just coping with the challenge.
Okay. So finding number one is there is established wisdom in the community about
Coping response, especially on cultural aspects.
the finding. Where is it? Report.
Yeah, it's stated in different words, but it needs to rephrase it.
So that's very important. So this, as somebody, listen, guys, you should say that. You shouldn't be shy about it. I didn't get that right response. Coming back to it, you say PDA is recommended to be implemented in a wider scale, both in urban and rural settings. Nutritional status of children. Am I right?
Yeah.
Why do you recommend this?
So just I want to introduce it actually.
So nutrition with a specific focus on factors that influence breastfeeding, such as the age of mother, exposure to information, occupation, antenatal care, postnatal care. And what is new there? We know this. These are reality on ground. These are established facts that those factors that you have identified.
I think these are baseline outcomes have included to say as a
Sorry?
from the baseline assessment that
Yes.
I want to show. So maternal child deaths like parity, MC, and ANC.
Classified or categorized the recommendations into policymakers, into health sector districts, healthcare providers, future research, and so on and so forth. I was like asking myself, wow, great. However, you can pick all the bullet points, but The first bullet, more research on the interventions, feasibility, sustainability, adaptability is required.
Research, especially when we conduct immunology, actually is descriptive, and we need to have some sort of bracketing,
Yes.
keeping ourselves neutral, of ensuring the transfer. I'm neutral from the study. Neutral. That's self-reflexive myself from the study, but
You are neutral.
yeah, I think I tried.
Because somebody from near ocean, called her and said, wow. So she called to know what is kind of question. And to your surprise, when you get at the ministry, you are escorted. Somebody escorted you to where she is. And you knock at the door, you are in. And you found 4 people. 4 people. One is herself, the minister, a professor of nutrition from our school, School of Public Health, who is closely working with the ministry quite frequently on nutrition. And she congratulated you. Thank you so much. From Jimma University, I realized you've done a great job. But we are here, we were actually as a minister for the program, and the guy from the Maji district, the elderly person, were asking, so what is it for me? So how do you respond to them? We have the 4 of us.
Tough question, but I have to choose a common word that everyone can understand. So for either the minister, the professor, and the like, so my issue is just collaboration as power, as public intervention, collaboration. So the either, sorry, there is one word or there is different?
No, tell for the minister, this is what I have for you.
At local level, local culture, local level of understanding should be basically applied. And for the professor, I would recommend that the implementation, effectiveness, fidelity, and others should be studied in long run. But for the elder one, I can say that elders should youngers, because gender issues, cultural understanding of marriage are just a contributing factor for inappropriate infant and young child feeding practice. Therefore, they have to advise.
So this is the time to declare the grade and the score of Abraham. So I kindly invite Dr. Melgisa to declare the results. Thank you.
Yeah, thank you so much. Yeah, very important time, right? Very important and difficult as well. So, well, thank you so much, Jimma University, for having invited me to really see also the progress in terms of how PhDs are bringing here, and is not meant to fail you, but rather to really serve science. We are here to serve science. We are here to serve knowledge. So we are all contributing to just making argument for the sake of argument was not you so great. You were confident in the whole effort that you've made. But we also sort of tried to differentiate between you as a candidate and the institute or department, for that matter, we have. So we took off that from you. But we also realized that there are. So in view of that, we anonymously, and myself and this gentleman here agreed to give you a very good grade. Congratulations.
Again